We're joined back with Chief Medical Officer of Ruhr Memorial Hospital, Dr. Andrew Bushnell. Doctor, thank you for joining us once again. Some more questions for you. So many people are wondering if simple good hygiene is the best avenue to protect yourself, but is there anything else in terms of courses of action that we can do to prevent our chances of contracting?
Oh, certainly, Thomas. Right now, if you've listened to the news, the state and the federal news, social distancing is what we should be following. We don't want to be in any gathering of more than 20 people, and even gatherings smaller than that, we need to watch for those folks that might be ill. We don't want to expose ourselves to places where there are a lot of people. We want to stay away from our elderly folks if possible if we're sick, and certainly if we're sick we don't want to go to work. We want to stay home. We want to keep our sick children home also.
And some of our viewers are wondering why we can't just get tested quickly at this point. Do we have a timeline for when testing will become available to the general public?
Right now, we're catching up with testing. The federal government has released more and more tests. Our governor has told us that there are a number of state labs that are coming online. So we should have resources to test more people very soon.
And many viewers are also wondering how far away are we from a vaccine?
We are at least 6 to 12 months away from a vaccine, maybe longer.
And what are the signs that we should look for if we may have a suspicion that we may be coming down with the coronavirus or maybe a loved one?
So we should look for cough, shortness of breath, or fever. Those are the symptoms that most of us will get if we track the coronavirus, if we can track this novel disease process.
And quickly, we do have some direct questions from our viewers. This one, should we wash our hands before going to the bathroom or changing a baby's diaper? Should they wash their hands before that as well as afterward?
Well, this is an easy one because it doesn't matter about coronavirus. We should practice good hand hygiene in all these circumstances, and before and after, especially if we're taking care of our babies.
And another viewer question, how does this virus affect pregnant women, and could it affect indeed an unborn child?
A lot of that information is not known yet. We do know that other coronaviruses that caused the other outbreaks of SARS and MERS, which were severe diseases in the past decade, did have some adverse effect on pregnant ladies. So we do want to be careful with this population. We want them to take as much precaution as possible to try not to contract the virus. We also have seen, at least in the China studies, that this virus is not transmitted from the mom to the baby in utero. So the babies are born without the virus.
And quickly, final question. We talked about this a little bit earlier before this interview, but how long could this last? What do we know? What do we not know?
What we don't know is how long it can last. We don't know if this is a seasonal virus. We don't know if the summertime is going to stop the spread. This is a brand new virus that has created a pandemic. It is around the globe. It is occurring in warm environments as well as cold environments. We need to see what happens over the next several months to see if this stops sooner than later.
Well, Doctor, thank you. We're going to have more questions along with his answers on our website, cnyhomepage.com. Doctor, again, thank you for speaking with us. We'll close out the broadcast when we return.